So in bisecting angle technique, the film packet is placed as close to the tooth surface as possible. The angle formed between the long axis of the tooth and the long axis of the film packet is assessed and mentally bisected. Already discussed these things. The film should be placed as close as possible in bisecting angle technique, and the X-ray tube should be, or the X-ray beam should be parallel to the line bisecting the long axis of the tooth and the long axis of the film. So in bisecting angle technique, the X-ray tube is positioned right angle to the bisecting line with the central ray of the X-ray beam aimed through the tooth apex. We have already discussed these things in previous images, like how the X-ray should be parallel to the line bisecting the long axis of the tooth and the long axis of the X-ray. Using the geometrical principle of the similar triangle, the acute length of the tooth in this mouth will be equal to the length of image on the tooth film. So this is the principle of bisecting angle technique. How bisecting angle work? The principle of bisecting angle technique is that it is based on the geometrical principle of similar triangles. If the two similar triangles will be there, like two similar triangles will be there, so the image will be equal to the line bisecting these two triangles. So what is the vertical angulation for the tube head? Now let us see principle of vertical angulation of the X-ray tube head. The angle formed by the continuing the line of the central ray until it meets the occlusal plane determines the vertical angulation of the X-ray beam of the occlusal plane. So we have already seen what all are the different X-ray, the vertical angulation of different teeth of maxilla and mandible. So this is the vertical angulation. Now let us see what is horizontal angulation. So the horizontal angulation will be changed according to the teeth. So as you can see, it will be 0 for the molar, it will be 10 for the premolar, it could be 20 for the canine, it could be 30 for the anteriors. So it varies accordingly. It is a for the lower teeth. For the mandibular teeth, these all are the horizontal angulation for the different teeth. Now positioning technique using a film holder. So how we are going to position the film? It is a recommended technique to avoid irradiation of the patient's finger. However, using the finger is still widely used. So maxillary anterior teeth is a tooth of interest. So in that case, the angulation will be 45. As you can see, the vertical angulation will be 45. Maxillary anteriors are tooth of interest. So in that case, the horizontal angulation will be 45 degree. Here you can also observe that thumb is used for placement of the film. As you can see in this picture, there are different type of film holders are available. There are the different kinds of film holders we can use. Now let us see advantages of bisecting angle technique. The first advantage is that positioning of the film packet is reasonably comfortable to the patient in all areas of the mouth. So the placement of film become quite easy and comfortable for the patient. And the positioning is relatively simple and quick. If all the angulations are assessed correctly, the image of the tooth will be the same length as that of a tooth itself and should be adequate. But here we have to note, it will not be properly ideal. The tooth length will be adequately okay but not the ideal for most of the diagnostic purposes. And it is more comfortable because the film is placed in the mouth at an angle to the long axis of the teeth, so the film doesn't impinge to the tissue. So the chances of tissue tearing is very less and it is quite comfortable to the patient and for the dentist as well. A film holder, although available, it is not needed. Patient can hold the film in the position using a finger. So the film holder can be used for placement and either patient finger can also be used. So in bisecting angle technique, no anatomical restriction is there. The film can be angled to accommodate different anatomical situation using this technique. So we can also take a different radiographs of different morphologically altered tooth and also different anatomical structures. Now let us see what are the disadvantages of this bisecting angle technique. More distortion. The distortion of the image clearance or the image sharpness is less because the film and the teeth are at an angle to each other, not parallel to each other, so the image will be distorted. And in case of bisecting angle technique, it becomes harder to position. As already mentioned previously, because the film holder is often not used, it is difficult to visualize where the X-ray beam is. So the X-ray beam, where it is going, it becomes quite difficult to visualize and the positioning of X-ray beam become difficult. The film is less stable. Using finger retention, the film has more chances of moving during the placement. These are the disadvantages of bisecting angle technique. Today we have seen what is dental radiography and what are the different types of dental radiography, and we have seen in detail about intraoral dental radiography, and in which we have seen a detail about bisecting angle technique.